Thank you so much, Blake, for the very kind introduction. A very good morning to all of you again. Welcome those who join in person and also who join online. It's indeed my great honor to be the first keynote in this very important occasion. And as Professor Rick Wan has already mentioned the title of my presentation. So today what I want to do is to let you have understand more about Translation Research Center for Digital Mental Health, why we established this center and what we are now doing. And then I will also present some of the studies that we are currently doing and some study that we have already completed. Yeah. So I hope that then I will, you will be able to have a more comprehensive overview of the progress of our center. And I really look forward to our future collaboration, after this conference. Yeah. And why digital mental health? I'm sure that we all know that we have increasing number of people who have mental health issue, especially common mental health disorder, such as depression and anxiety. And according to WHO report, 1 in 8 people globally live with a mental health condition. And but what we also know is 85% of those with mental disorder may receive no treatment. And that's why there's a growing gap between the demand and access. And that's why that is a very important reason that we have to drive digital innovation. And we also know that the COVID-19 pandemic, in fact, accelerate the adoption of digital tools and also transforming how mental health care is conceived and delivered at scale. And if we look at the those who suffer from mental health disorder, the population increasing, and with the number of mental health provider, especially in Hong Kong. And this is the latest statistic from Hong Kong. So in Hong Kong, if you look at psychiatrists, okay, and psychologists, it's very similar. So currently we have 7.55 per 100,000 person, which is much lower than many other countries. And in Hong Kong, if you have mental health issue and if you are stable and new case, you have probably have to wait for 44 weeks before you can get in touch with a specialist. Yeah. And of course, if you have money, you can go to private, but not a lot of people have that sort of money. And the delay in seeking help and receiving help have may cause deterioration in mental health and have a lot of impact in the individual and the family. So the situation is not optimistic. Then the question that we want to ask is, can digital mental health open doors? And if we look at what do we mean by digital health, mental health is a lot of tools and a lot of technology. For example, teletherapy and online platform. Many of you may experience that you use a video, phone, or messenger to deliver your therapy. And you may develop app. That is, we have a lot of self-help program delivered by apps. For example, CPT or behavioral activation. And according to statistic, we now have more than 10,000 mental health apps available on major platforms. And we also have AI-powered chatbot that provide automated support to our clients. And with the improvement in technology, we now have more accurate wearables and biometric monitoring that can help us to monitor heart rate, sleep, and stress pattern, and may be able to predict mood or other mental health fluctuation. So now we have the technology that we really can use to help us to deliver mental health, digital mental health intervention. Then is it effective? And if we look at the current evidence, we can see there are meta-analysis and systematic review. In the current, a very current review by Lancet Digital Health, an umbrella review of RCT confirmed digital health intervention could be effective for depression, anxiety, and stress disorder. And where some other studies also sort of have this confirmation. For example, workplace digital mental health intervention, so small but significant effects on depression, anxiety, and stress. And the same as other systematic review. But majority of these studies are conducted in Western country. In fact, in Hong Kong, the digital mental health is just at its infancy, at its starting. It is really just starting. We don't have a lot of evidence in Hong Kong to say whether it is effective or not. So that's why 2 years ago, we, with the support from the University Grants Committee, we formed the Translation Research Center for Digital Mental Health. And this is an interdisciplinary center. So we have team members from healthcare disciplines, psychology, education, and management. And what we want to achieve is we want to promote evidence-based practice in digital mental health, especially in Asia region. We need to generate evidence and we need to communicate those evidence. And we also want to build capacity in translational research. Yeah, and we are not doing research in laboratories. We want to translate the knowledge into actual community so that we can create social impact. So we want to train our students and staff in translational research. And at the same time, we also want to synergize interprofessional and interinstitutional collaboration. As I've mentioned in my opening, mental health problem has no boundary. So that's why it calls for interdisciplinary and interinstitutional collaboration and also global collaboration in order to solve these complex issues. So we want to achieve all this. And so at present, our center conducts systematic review, literature review. We conduct research studies, and all the studies are community-based intervention. And we publish, and we're also building a platform so that in the future, we can share all the evidence that we produce. And so towards the end of the 3 years, we would also like to produce policy paper that we can submit to Hong Kong government in relation to the development of digital mental health. And we have a lot of partners. These are some of the examples because we conduct our studies in community. That's why we have a lot of community partners, NGOs, and a lot of organizations. So I hope that in the future, we can be partners as well. And come back to the studies that we conduct. Going back to the first study conducted by this center, the questions that we want to ask is that, yes, we talk about digital mental health, but does it work for older adults? Would they accept digital mental health, or would they want to use it? And we know that in the previous research, it said that, yes, learning a new technology for in older people, for them, it can keep the brain active and lessen the isolation and allow them to have more self-care. Yeah, but we don't know whether in Hong Kong, older people would like to accept digital mental health and they can learn. That's why we start our first study, and our collaborators, Professor Chin is here, yeah, and also our team members are all here. So this study is funded by Phase 1 of Mental Health Initiative funding scheme. And in this study, we have 3 objectives. The first, for older people, we would like to enhance the digital literacy as well as the mental health literacy, so as to enhance the mental well-being, self-efficacy, social support, and quality of life. And it's not just older people, because we don't want to create an app or some technology. Just we ask the older person, okay, you use it, because it will not work. So that's why we have our digital buddies. We pair them up with our young students, so they are digital buddy. So digital buddy will help our older person to learn digital literacy and mental health literacy. So we also have to equip our digital buddies with appropriate teaching and communication skills and also mental health literacy. They are very good in digital literacy, but not good in mental health literacy. So we also have to prepare them. And for both, we want them to build a relationship and enhance intergeneration connection and support. And so we developed this app with a psychological diary, and we produce a lot of videos. So we have 73 barrier-free learning videos. for example, how to use the mobile phone, how to use the mobile phone to take a communication, take photos, etc. And then mental health literacy. What is mental health? What is anxiety? And how to deal with grief, that sort of topic. And we have mental health promotion, brain exercise, and emotional management. So all these videos are embedded in the app. And we also produce training for our digital buddy. So they have to learn how to communicate with older people, how to communicate with older people who may have a sensory deficit, and how to talk to them, how to talk to people who may have a mild cognitive impairment. And apart from all this, we also embed, teach older people how to use some common app that is already available. For example, Hospital Authority Go and e-health platform and all that, because these are the platform that they will or they have to use regularly. So we teach them all that. And so for this project, we reach out more than 1,000 older person. So we help them to learn digital technology and also mental health literacy. And we also train more than 150 young volunteer. They are digital buddy, and teach them how to communicate, how to interact with older people, and then they engage in our project. So for in this project, all the participants will undergo a 23 hours, 14 session training in digital literacy and also mental health literacy. And so it's about 14 weeks. And some of you may wonder, would older people engage in this long training session? And to all our surprise, they are so energetic. So all of them came on time and attend all the sessions. Yeah, and very few miss any session. So that means they are interested and they are willing to learn and they want to learn. Okay. And so we develop all the materials and we divide them into two groups. One is intervention group, one is control group, because we want to evaluate the outcome. And these are outcome measure. We measure the mental well-being, depressive symptom, quality of life, self-efficacy, and social support. And so we also publish our protocol. For those who are interested in knowing how we conduct the study, you can read this protocol. And okay, these are some photos of our training session. So towards the end of the session, we present each of the older person a certificate. They are very excited about this certificate, yeah, because they have not been in class for many, many years. So they like the certificate. Yeah, so we give them a certificate. So towards the end, everyone got a certificate. And we also give certificate to our young volunteer. And for our young volunteer, they are students at Tonga College. And the hours that they devoted in this project, we recognize them as a community engagement. So they also get some credit for this engagement. And as for the results, you can see that we have significant difference between the two groups in the mental health well-being, as well as the reduction of depressed symptoms, whereas we could not find any other significant difference in other outcomes. And in fact, we also interviewed them, and many of them show appreciation to this intervention, and they always want to learn more. And for the young volunteer, they also appreciate this opportunity to interact with older people. So they also learn the skills of interacting with older people and understand their needs. And we have published the findings of the study. For those who are interested in this study, you can read the paper. And after we complete the study, what are we going to do then? So we revamp this platform. And we all the centers who participate in this study, they can use it whenever they want. So it's now open to everyone. So we don't want to commercialize this app. We want to make it available to everyone. So everyone who have interest to use this app, they can download it on the phone and use it. Okay. So this is our first project. And the second project I want to share with you is about virtual reality. how we can use virtual reality for promoting wellness in older people. And in this study, we focus on older people who live in long-term residential care facilities. We know that those who live in long-term care facilities, those older people usually are frail, have physical disability, and have multiple chronic diseases. That's why it's very difficult for them to get out of the facilities very often. And a lot of study also show that older people live in long-term residential care facility. A lot of time have depressive symptom and experience loneliness and have poor quality of life. So if they can't go out, then can we bring the reality into the facility for them to experience the reality? So that's why we have this project, Inclusive Virtual Reality and Mental Wellbeing in Older Adult. So it's supported by Phase 2 of Mental Health Initiative Funding Scheme. And so we work with our industry partner. And in fact, we developed a first of its kind Hong Kong-based VR immersion program. Many of you may have used VR, but those VR are not developed in Hong Kong. Yeah, and if you look at the scenery and all that, they are all overseas and all that. So this is the first of its kind development in Hong Kong. And we developed about 20 VR scenario based on nature, travel experience, and immersive reminiscence. And so the VRs are divided into 3 sessions. The nature, so we show them forests, snowy mountains, birds and rivers and all that. And we also have travel experience. For example, going to the Big Buddha at Nantou Island, going to the Old Macau and New Macau, Ocean Park at the Peak, etc. And we also have immersive reminiscence. For example, show them the old wedding banquet in Hong Kong and historic tramway. And why we have these 3 categories? Because evidence show that if for natural sceneries, travel experience, and immersive reminiscence may have a positive effect on people's mental health. So we develop all this by ourselves. So it's all self-developed. And so we also train our young buddies to deliver this virtual reality in the long-term care setting. So you can see that they can view the virtual reality while they're lying on the bed or sitting in the chair. So it's in a very controlled and safe environment. And also, you may sort of wonder whether older people will accept VR. Are they willing to wear the goggle? Yes, they are willing, and they are very motivated to do so. And so we train our young buddy. So they go in the long-term care facilities one-on-one, and they provide briefing to them, and then they experience the VR. And then after that, there was debriefing. So they talk to the participant and ask them about the experience. So it's not just willing the VR, it's also includes social interaction and emotional support. So we, in fact, the total number that we have engaged is more than 500, but we don't need that many in our RCT. So we randomized 26 centers, and so each group have 133 and 132. And so some older people may be too frail to participate, but it's not a lot. Yeah, and for those who are interested, you can see that the withdrawal rate in fact, was very low. And so we measure the outcome, mental well-being, depressive symptom, loneliness, health-related quality of life, and perceived social support. And so you can see majority of them were female. As you know, that female live longer. So more of them are in long-term setting. And many of them with low education level. And we also publish the protocol of this study. And if you have interest to know more about the actual details of our study, you can read the paper. And so from the result, we found that there's a within group difference in mental health and reduction in depressive symptom. But for between group, only the quality of life have a significant difference. But I think that is a good direction for us to move forward. And in fact, we also interviewed the participant. They were introduced to technology and they are willing to accept it. And they are motivated to engage. And many of them describe the VR scene as very enjoyable. And they always associate the VR with the personal experience. So for example, after viewing the old Macau scene, then they start to talk about the experience of traveling to Macau in the past and what they've seen. And during Chinese New Year, some older people, particular, would like to view the big Buddha in Lantau Island because they want to pray to the Buddha, though they cannot be there in person, but still they want to pray. Yeah, when they view the Buddha in the VR. And so I think that is very good because when we develop this technology, we want it to be personalized. We don't want everybody receive the same thing. So we can give them option and they can choose what they want to see. And a very small number of participants experience some side effects with VR. As you may know, some may report dizziness and discomfort, but they are willing to try again after the symptoms subside. And so we also publish the results of this RCT. And if you have interest, you can also read this paper. And so after we conduct the study, we have a press conference and we attract a lot of media attention. And we were invited to be interviewed by RTHK as well as the Hoi TV to talk more about this VR project. And we have patented this VR software. And for those who want to purchase it, so please look out. Yeah, so we call it Everjoy VR. Okay, so it will be available in the market very soon. And so after we established Translation Research Center for Digital Mental Health, we established a sister center, affiliate center at Sichuan, Chengdu, and in collaboration with a vocational college. And they are very interested in this VR project. So that's why, you know that for the VR, the experience, it has to be related to the culture. So we cannot bring the Hong Kong scene to the Chengdu participant. That's why we develop some of the scenery. We include Sichuan opera, tea house, festivity, and nature that is related to Sichuan. And so our Professor Guan went there and conduct training to the staff and student there. So they're going to deliver this intervention in Chengdu in the older persons center very soon. And we look forward to the results of this new study. And if you have interest in using this VR in your place, please let us know. And we are very happy to collaborate. Okay, so we have two studies we have complete. There are two studies that is ongoing. I would like to briefly mention it here. The first is improving mental health for adolescents with special education needs, SEN, using social robots. And we know that children with special education needs may be more vulnerable to emotional and behavioral difficulties. It affects the learning and also the quality of life. And study found that self-disclosure and self-compassion, that means if they know themselves more and if they can accept themselves more, they may have to reduce the anxiety and stress. And so of course, if we use a person-to-person intervention, it will be very costly and labor-intensive. So that's why we thought about social robots. In previous studies, found that social robots demonstrate effectiveness in supporting children with SEN, for example, in academic support, cognitive development, and social interaction disability. So that's why we conduct studies. So we use a social robot. We use the third head robot as a tool to deliver the intervention. So this study is led by Professor Alex Chan. And we want to know whether the social robot media program can increase self-compassion and reduce general stress level among students through self-disclosure and self-compassion training. So this is a free-armed study. So we have the social robot arm, we have the human counseling, and we also have computer group. Okay, very interesting. And for the social robot, we train it ourselves. We are not, we didn't use the OpenAI because it's very dangerous to use OpenAI. So we train ourselves. And so we have computer training and we are starting the study. And before the study, we of course pilot. And you can see this photo. This robot, we put a wig on it because we have different type of wig and we have a cap to make it more like a human. But when we show it to children with special learning needs, they don't like the human form. They like the real robot. Yeah, they like a robot. They don't like a human. Okay, so that's why it is sort of, it's important for you to have this sort of user engagement before the actual study, because they like to talk to a robot. They feel more safe to talk to a robot than a human. Okay, so that's very interesting. So we really look forward to the outcome of this study. And the last study I want to talk to you is building a new model for providing mental health support to nurses and healthcare workers. And so we have a lot of health programs at Tonga College, and we have a lot of nursing students as well. So undergraduate nursing students, when they go out to clinical placement, they always encounter a lot of stress and they are very anxious. So of course we can have one-to-one counseling, but it would be very difficult and time-consuming and costly to have a sort of human counselor. So that's why we would like to develop this AI-powered mental health kiosk. We want to provide rapid assessment of general stress and help-seeking intention. So that means the student can go to this kiosk and then they can start the mental health assessment and also the health-seeking intention assessment. And after that, then the AI will analyze the condition and then delivers tailored recommendation based on the assessment result. And this kiosk, we have developed Cantonese version, Mandarin Chinese, and English version suitable for different type of language. So we hope that by using this AI powered kiosk, we can help the student to understand more about their own stress and also to understand the resources available for them to seek help. And for us, after we complete the study, in fact, we want to expand this study, not just to a student, but also to the qualified nurses and, for example, new graduates in the hospital and also in other settings. So this intervention is very scalable. So we hope that we can have the outcome of this study very soon and be able to report to you. Okay, all in all, we have conduct different studies and different reviews. And so my thought is we use digital mental health. And the reason is not to replace any of the human therapists. I think it's an important alternative to people. Yeah, it's important that we provide alternative. So they have opportunity to choose whether they want to seek help from a digital tool or human therapist, or it can be complementary. So do both. Yeah, and it has to be integrated into the practice setting. And at present, there's no regulation in Hong Kong, no clinical validation or safety standard related to AI chatbot or other apps. And I believe that's the part that we need to pay attention and develop. And with the development of AI, we can make our intervention more personalized. And I believe that that is a very good way to do so. And also with individual biometric and all that. And in the future, we can deliver a more personalized intervention through digital technology. And we cannot forget the gaps, the digital gaps. And we always have to aware that many people may not be able to access, or they may not have the digital health literacy or cultural adaptation. So we need to pay attention to that. And thus far, many of our study only focus on short-term outcome, and we need to continue to conduct study and to understand more about sustained engagement, whether digital mental health intervention can engage the clients in a longer term, not just a short term. And so that's why I think for our digital mental health center, and in fact we have a new center called Share, is the Smart Health Applied Research Center. And when we conduct a study, we really have to take into account of all this. We develop a lot of technology, tools, and all that, and how we can ensure that it's safe and with clinical validation, and also have can sustained engage our client. All this we still need a lot of work that to help us to find the answer and to find a better way of delivering digital mental health intervention. So with all this, I hope that for all the delegates in this conference, we hope we can, after this conference, we can keep in touch. And I hope that you will be interested to collaborate with us in various projects and continue to attend our different events and also join our network. So with this, thank you so much for your kind attention. Thank you.
Thank you, Professor Chen. Now we would like to invite Professor Kwan to moderate the Q&A section.
So thank you very much for Professor Chen's wonderful presentations. Open up our horizons onto this particular area, digital mental health. So we don't have too much time. I think 10 minutes. I think at most we can take 5 or 6 questions most. So may I invite all of you on the floor to put up your hands if you have a question, please. Yeah, can I ask somebody to check online? So do you have any questions? So don't be too shy. Okay, if there are not any, probably I started fast. Okay, so I see that although I am part of some of the projects, but I think that I'm sorry. When in the road, when particularly we're developing to become an universal applied sciences, we have always been asked to have tripartite collaborations between academy, teaching, research, and also industry. So may I also ask your thoughts about how to make all this to be applied, because this is important to follow the the directions of the Hong Kong government or probably the trend. So may I hear your advice on this direction?
Yeah, thank you for the very important question. As we maybe let me talk a bit about universal applied sciences. Yeah, why we have this term? Because in Hong Kong, the Hong Kong government would like to have 2 categories of university. One is the traditional research-intensive university. The other type is universal applied sciences. So that means we offer professional and vocational training to students, and we work closely with the industry to offer programs. We also work closely with the industry in applied research. In fact, all along, the research that we conduct at Tung College is all applied. That means we do not do research in laboratories. Yeah, we transfer the knowledge that we have, and then we implement it in the community and in our client in hospital, and to test the outcome. All along we are doing this sort of research. But now I believe we need to have a much more closer relationship with the industry. For example, in health, just use this example. A lot of time when we conduct research, we researchers sit in the office and think about a problem. Yeah, and we believe it's a problem. So we write a proposal. Yeah, and then we bid for a grant to resolve this problem. But is this a real problem in the clinical? Yeah, we are not too sure. So that's why we need to work closely with the industry to identify what is the real problem that they encounter and how we can work together to resolve that problem, to bridge that gap. I believe that is the essence of the sort of applied sciences, and it's not the research driven by curiosity. Yeah, it's the research driven by the real problem that people encounter in the day-to-day work. Yeah, so that's why working with industry is our future direction. And of course, now we work with the industry. It is the extent. I believe we need to build a much closer relationship with the industry, both in education and also research. And when we talk about this research, it's not just the academic research. And you know that in our education program, in our degree program, the final year student, they all have to do a capstone project, a research project, and how we can link this capstone project with the industry needs. Yeah, how students can really go to the industry, talk to the industry, and understand the problem, and then bring it back and do a capstone project to work with the industry to resolve the issue. That is very important. And the second is our postgrad student project, our master degree and PhD. I believe we also have to follow this line. So it's not what the PhD student want to do, it's what the industry, the needs of the industry. What are the clinical problems that the specialty encounter, and how the PhD study can help to resolve or offer a solution to that problem. Yeah, and I believe that is the direction that we have to move forward. Yeah, it's the closer and more intense relationship with the industry in delivering our education as well as our research.
Yes, thank you very much. I think this is a very fascinating model, at least to showcase how we can develop applied sciences, and it is also very forward thinking model. So. But before I ask again, so because I personally have a follow-up question to ask, so we see a lot of success, a great success, at least to start with an applied research being a study in a center. But what kind of barriers or problems that we've encountered in a way, so that we might generously sharing the problems we face throughout the last 2-3 years?
Yeah, I think it's the sustainability of the project. Yeah, if we complete a study and then we publish and then nothing happened, then it's useless. Yeah, how we can embed this new intervention into the routine practice, that is the most important. That's why the beginning is important. We work with the, for example, healthcare industry, we identify a problem, and then we generate intervention to resolve the issue, and hope that because we generate this intervention together, it will be more acceptable to them, and they can adopt that into the routine practice, and then continue to evaluate and continue to sustain this intervention. And I believe that is the things that we need to do more. Yeah.
Yes, thank you very much. I think you just share a very interesting and very important pathway, because in the past, many academics are talking about me, myself too, spend a lot of time in office writing papers. But nowadays, we really reach out to the industry, because opportunities are out there. Opportunities are those we need to unearth them. So spend a lot of time. So under the leadership of Professor Sally Chen, we actually have connected a lot of partnerships and industries to kick off all these connections. Otherwise, nothing could be successful or such things like what we have achieved. So thank you very much. And we still have 3 minutes. So may I ask if you have anything to ask? We can take one more question. Yeah, please, Professor Gajoli. Yes, please.
Professor, no, it's going to be. Professor Chen, thank you very much for your address. It was fascinating work. I totally resonate with your analysis of the importance of sustainability. And I think that as an applied university, it's great that you are connecting with industry and so on. But as academics, I think we have also to change our forma mentis in order to make this happen, because industry needs are sometimes not converging with for example, clinical needs, in the sense that they are more market driven. And as clinicians, as psychologists, as psychiatrists, we focus more on the clinical needs of patients. So how do you think this tension can be kind of addressed or solved? And may design for more adoptable solution be a possible answer? So including other disciplines in the process, like design, for example.
Yeah, I understand your question. Yeah, because for industry, they want to have a product that earn money, that profitable. Yeah, but for a clinician, we want a solution that benefit the patient. But that too does not necessarily cannot merge together. I believe the most important is that we have a common goal. The common goal must be we want to enhance the quality of care for our patient. Yeah, we all have this common goal. And how we are going to reach it. Yeah, and so we can develop something to help the patient to do this and to do that. But when we develop that something must be acceptable to the patient.
Yeah.
And it's affordable. Otherwise, they will not use it. And I believe there are common grounds that we can work together. It does not necessarily that we the industries go and the clinicians go or researchers go are all sort of contradicting each other. Yeah, the most important is that the final aim is for the benefit of our client or our patient. Yeah, so if we put that as the very important goal, then I believe we can sort of massage along the way of how we are going to do that. Yeah,
Thank you.
Yes, thank you very much. So to conclude these sessions, I think most of the great ideas start in a very turbid way. So I remember what Mark Zuckerberg said, all we need to do is just to get started. Okay, thank you very much for this.
Thank you, thank you, thank you.
I think that I will just hand it over to our MC, please. Thank you.
Thank you, Professor Chen, and thank you, Professor Kwan. So thank you very much for your for the first section of the keynote lecture. So now we are going to have a networking break, and our program will resume at 11 a.m. with a keynote lecture by Professor Sanjay Bucci. So thank you very much and enjoy your break, please.